Please note, this episode contains sensitive topics that are intended for mature audiences. Listener discretion is advised.
Hi, everyone, and thank you for joining us for this webinar. My name is Eliza Leiter, and I'm a third-year medical student at the Hackensack Meridian School of Medicine. Tonight, we're going to be exploring the topic of postpartum psychosis with Zahava List, a survivor of postpartum psychosis, and the expertise of Dr. Tal Weinberger, reproductive psychiatrist. We wanted to hold this webinar to increase education of this condition, as the understanding and awareness of its presentation and treatment may not be as widespread as other postpartum mental health conditions. Before we begin, I want to let you know that participants are not visible to each other. You can post questions in the Q&A box throughout the webinar, and these will either be answered in writing during the webinar or by one of the panelists during the Q&A portion at the end. The chat box is disabled. I'd like to thank Zahava for her bravery and willingness to share her experiences for others to learn from. For the past 8 years, Zahava List has dedicated herself to supporting Jewish women worldwide who face mental health challenges. Her personal experience with postpartum psychosis and bipolar disorder has driven her passion for creating Cheskenu, a loving, non-judgmental community where women can connect and find support. Zahava's leadership and vision have profoundly impacted the organization, offering invaluable peer support to those battling isolating conditions. She resides in Baltimore with her husband and 4 sons. Zahava?
Okay, thank you so much. I want to thank JOMA, such a fabulous organization. You are really giving so much to the community. I want to thank Dr. Weinberger for inviting me, and really, I just have to give so much credit to all of the participants tonight. Just being on, being curious, wanting to get the knowledge, coming from a perspective of someone who's been through it, as well as a professional. Postpartum psychosis is something that's very often misunderstood. And I hope that tonight, between hearing my story and hearing from Dr. Weinberger, that you can come out feeling that you understand, that you can now look at it in a broader perspective. So it's hard to take, it's been 19 years since I was first diagnosed. And it's so hard to take 19 years and put it into just, a couple of minutes or 20 minutes here tonight. But I'll do my best to really give you kind of a perspective and a picture of what I've been through. So when I was 23 years old, I had been married for just 10 short months, and I gave birth to a baby boy. And normally, as a new mother, a mother is very busy with their baby and just settling in to, becoming a mother and sleeping and trying to take care of themselves and just bouncing back into real life. But that was far from where I was holding at that point. I was not sleeping. I was not eating. I was getting more thoughts of grandiosity, thinking that I have powers that other people don't have. I was able to read minds. I thought I could, really take on the world. I was saying and doing things I normally would never do. I didn't have any filter or inhibitions. I almost describe it as somebody who's consumed alcohol or drugs, but I didn't. I didn't have the high from drugs and alcohol, but I had a high from the hormonal levels that were going on inside of me that were not in a balanced state. And really, during pregnancy in general, there's so many hormones that are going on, and it's really a miracle when after birth everything could slowly get back into place. But for me, it wasn't that case, and it was really, for me, it went very quickly. Within 10 days, I was completely, in a very, very high manic, like, full blown mania. And I had, features of like psychotic features. For example, like I was completely numb to regular feelings. I was like almost like not even in this world. I was totally out of it. I would have like I remember burning my hand and not even feeling like it was burnt. Like I just wasn't even like feeling physical symptoms. And during the day, I was making calls like to rabbis, asking them if they were Mashiach. I was, I was very into nursing my baby. And, I had during pregnancy, like worked with a lactation consultant to like really, I was very much into that. But I was like not really able to be present for my baby because I was too busy calling friends to ask them, if I could help them with their relationship with their mother, and very, very focused on trying to save the world. That was what was happening during the day. And at night, when I wasn't able to sleep, a lot of things that happened to me in the past that I never thought of as anything different were really trauma responses for myself. I was, different things were being brought up that happened during my childhood that really affected me very deeply, that I didn't even have, what to process or anything. And I remember just sitting there talking to my husband, telling him things that he couldn't believe was coming out of my mouth. I couldn't believe was coming out of my mouth. But I almost felt like when giving birth to my son, I was giving birth to the psychosis, I was giving birth to the trauma. And it was getting to the point where I was saying things like, I'm not needed in this world. And, um, I wasn't able to be trusted with my judgment. Um, I'll go into, because it wasn't only this one episode for me. There was a lot of, over the first 10 years of my illness, I had 7 episodes. And then about almost 4 years ago, exactly, I had my last episode. So lots of different things happened during the different times I was sick. But at that point, um, 10 days later, my husband was there, my in laws were there. They were like, "Who is this? And what did you do with Zahava?" I was completely not myself. And thank God I had a neighbor that lived near us that heard about what was happening with me, asked my husband if she could come to my house. She comes to my house, she comes in my bedroom, and she's like, "Zahava, you have some sort of postpartum response." I didn't know what she was talking about. I was like, "What are you talking about?" Like, she said, after birth, there's hormones, and sometimes, people can't by themselves regulate their hormones. They need medication. And, I know this because I myself went through the same thing. I, she had 8 children. She was like the mother, the wife that I always wanted to be. And here she was telling me that after her third child, she had a postpartum psychosis. She ended up getting a psychiatrist, getting a therapist, and she had that one single episode, and she was able to stay stable for so many years. But hearing from somebody who had gone through it herself really spoke to me very deeply, because even at the time I was telling her, "What are you talking about? I don't want to be I'm not a, I carried the stigma of mental illness, and I was like, I don't want to be on a park bench. I don't want to be in a sane asylum. Like, that's not me. I don't belong there." And I was really, really fighting her and telling her that everyone else is a problem, not me. And she kept saying, she's like, "That baby that I was holding," she's like, "if your son would have strep, would you take him to get antibiotics? Like, you need to go and get the medication that you need." And I was really not in a state of being where I was thinking clearly, but it was really because of my illness that I ended up like, I had a lot of delusions. I felt like people who were not alive were almost like alive in different forms. So I remember when I was actually like got myself to go the next day to the psychiatrist, I remember thinking like he's like symbolizes, something that is like going to bring the tikkun olam. It's going to fix the whole world, and that's why the medication. Like, it was through the delusions that actually ended up convincing me to get onto the medication. Um, and it was also, I was so grateful because there's an organization in Eretz Yisrael. It's called NITSA, and they're specifically there to help with postpartum, women who are experiencing, whether it's depression, postpartum anxiety, psychosis. And at that time, they were the ones who set me up with my psychiatrist. They gave me a mentor. They they eventually found my therapist a few months later. But it wasn't like just so smooth sailing after that. It was the medication, the way that my doctor treated me at the time was to just avoid at all costs me going to the hospital. So he put me on the highest level of antipsychotics and mood stabilizers, so much so that I felt like it was almost making me into like a human zombie. Like I was sleeping hours and hours, but also my body had to get back into a normal balanced state. So what I think of it based on my experience is kind of like, in Judaism, we talk about like going to the opposite extreme to get into the middle. So I almost felt like because I was so high, then I needed to get back into the middle by going almost all the way to the other extreme. So I did experience a pretty severe depression, but in my case, it turned into bipolar 1, which is primarily the mania psychotic symptoms that are severe, and the depression is not as severe as the psychosis. And Dr. Weinberger will talk more about the differences with bipolar um, in connection to psychosis. But for me, the reason why they called it bipolar is because I've had several episodes afterwards of the mania back to the depression, and both sides of the coin. Um, but I felt very much alone in my struggles because I was living in Israel at the time. And a lot of people were telling me once I was getting back into reality, I would say it took a while. It took like, it was for me when I was put into these high levels of antipsychotics and all that, like I was kind of in a mixed state where I was leaving the mania, but I was also getting very agitated quickly. I felt like very out of control. So I was doing things to try to get back my control, which were not very safe. The along with the medication that I was given was also instructions to my husband, to my mother-in-law, to watch me 24 hours a day. I was watched, or I would have girls come over and help me with the baby. Like this was going on for a few weeks where I had to be monitored because I wasn't in a hospital. I wasn't, nurses weren't giving me my medicine. My family was giving me my medicine. Later on, as we moved back to America, it was a different story in terms of how I was treated. But at that point, I had to be watched, and I remember the only time I felt like it was obvious that like I'm not in a place to at that point to take care of my baby in a way that I would when I was healthy was that it was very hard for me to go off, stop nursing. When I was giving my medication, I was told I could stop nursing, and I feel like there was so much unnecessary pressure to nurse because now that, like she said, I have 4 boys, and my last 2, I didn't even try nursing, and I can't say I'm closer to one of them than the others. And I think that it's a beautiful thing if somebody can nurse their baby, but I think it went completely for me as an obsession, and I think it actually caused damage to try to think that I could. When I ended up having my second son, I thought I would go lower on my medication so that I could nurse, and that backfired. And that caused another episode at that time with my second son. And so there's so many different things that have happened to me along the way in terms of my illness. I usually at this point I tell my story of how I ended up starting Chazkenu, but since this is a night that we're really talking about the illness of psychosis and the treatment of it, I really want to go a little bit more into what has happened over the course of this time and the years that happened. So during the 6 years I lived in Israel, I had 4 different episodes, um, and they didn't come because I took off my medication. They didn't come because I decided to put things in my own hands. Like for me, a lot of it, I ended up going to therapy like after that first episode, and I've never been out of therapeutic relationship. I've always had therapists, different modalities and different treatments, alternative treatments as well. Because for me, it really went hand in hand with trauma that needed to be processed. So the inner child work that I had and different things that came up for me. And that also, I think, contributed to relapses as well. Because when something was dysregulating for me, my automatic response, the fight or flight, for me, the flight was the mania. And what I've learned a lot along the way by doing therapy, like parts therapy, is that as although this is a physical illness and although there's chemicals involved and medication, for me has been a tremendous healing. And at the same time, I feel like taking care of my going through the parts of me that have gone through experiences that triggered responses like this helped me be able to see my psychosis as like a part. And that part of me that goes through that is really the part of me that just can't deal with the pain, and that the pain is just so hard that I almost have to escape. um but I did, I got myself into dangerous situations, even though I was taking care of it so quickly. Like, it wasn't like I let it go for 6 months and then eventually, no, like within a day, when I was starting to get manic responses. But once I got into a mania, and like it would keep getting worse until it got better. So in Israel, again, like the way the doctor did it was just putting me on a lot of medication and having someone watch me. But I was doing things like, I at one point I was in a situation where I was in a taxi, and then I was convinced that the taxi driver was really going to hurt me. And I literally opened the door of the taxi while it was going and jumped out, like things like that, where I was just so not in reality. Like, I was convinced that Rachel Imenu is like I'm a part of Rachel Imenu, and I had to go to Cave Rachel, and things like that. I remember going with my friend in Ramat Eshkol and in Israel, and we were walking, and I was like, "We're gonna bring Mashiach," and I was just very, very much very hyper spiritual and very much into that. So thank God, during that time when I did get onto medication and I did continuously see my therapist, I was able to reach into a back to really to my normal self and normal state. And then when we moved back to America, I the approach was different. When I did get sick, the doctor gave me medication, but as I was getting worse and I was more of a danger to myself, for me it was my own self saying things like I'm ready, like I'm not needed in this world. And like, thank God I didn't make any attempts or anything like that, but it was like getting to the point where I was already talking about not being needed. And that was like a sign that this has to be taken care of. And I remember them bringing me, that was the first time I was hospitalized. And this is going like, we're talking about like 6 years after my first episode. So this was the first time I was actually brought into the hospital. I remember them bringing me into the ER and saying, like, do you feel like you're a danger to yourself or to others? And I said, not yet. I remember saying those words. And they brought me into the hospital, and the more they were giving me higher and higher doses, I felt like the more sick I was getting. I wasn't responding to the medication, and so they felt like they needed to do something more. And the doctor who I had was, thank God, was the chief of staff of the hospital, and he recommended that I get ECT treatments. That's electric convulsion therapy. It's something that it's not the first, it's kind of a last resort when somebody is not taking to the medication. So it sounds worse than it is. The way people describe it is kind of like the modern day electric shock, but it's really a medically induced seizure. They put the patient to sleep and give certain muscle relaxants and, even ibuprofen, so that, because sometimes it could cause headaches. And the movement that happens is very, very minor. And really, like, it took several like months of doing the treatment. And what I say about it is that it helped the medicine do its job. It rewires the brain. It can either go through one side of the brain or both sides. And I don't know if science really understands why it helps, but it does. And for me, it did. And And every time that I was getting sick, like I said, this was 10 years and 7 episodes. After my first 3, I had an episode of psychosis, and the third one that I had, I didn't try to nurse, and I kept my medication. But at this time, it was a month after he was born that I ended up having the episode. So it did help like prolong it, but so it was happening, these cycles of, getting high and then dropping. It took a big toll on me. But when I was very high and I was talking to people and telling people, like, people come up to me like, ah, yeah, I have bipolar and I have psychosis. And like, so it was very, very open. Like, people knew when they saw me, something was up. And then, but then I would feel like all this shame because people would tell me, like, keep it quiet, don't tell people. So I was really, really having a hard time with that. I ended up going into a 12-step program. And I thought that that was going to help me in terms of, because one of the things that were hard for me from when I first got sick was my eating. It increased my appetite. And then I was very, very focused on that I needed to be in a certain size, my body. It happens to be for me specifically that every time I would lose a lot of weight, that actually would set on uh, a, a actual relapse for me. And everybody's different with that, but for me, losing a lot of weight at one time was not necessarily the best thing. But what I really appreciated about the 12-step groups was the fact that it was peer support, the fact that everyone was in it together, and that people were sharing their experience, strength, and hope. And that gave me an opening to start sharing my story. And even though it was very evolved because it was an OA 12-step group, it was around the food, but it really actually opened my doors to actually talk to other people and find other people who were struggling with mental illness. Fast forward, I ended up finding a advertisement for a Jewish women support group over the phone for women who experience infertility. And I said, "Oh wow, there must be a phone meeting for Jewish women experiencing mental health, challenges." And they didn't have that. So, long story short, like again, I felt that I had done a 12-step phone meeting in my own community in a local library. I already knew how to make a phone meeting. I said, you know what, maybe I could, adapt the 12-step program of recovery over the phone to a Jewish women support group with mental illness. And then I knew I couldn't do this alone. And I found 2 people, one from Rochester, one from Chicago, who also felt the same way as me, is that there wasn't enough support in the firm community, the peer support aspect in terms of recovery. So in March of 2016, we started our first phone meeting. I had thought of the name Chazkenu because just like, other organizations, there's another organization called Samchenu for widows, which is like to ask for simcha, for happiness, to go through the pain. And then I felt that for us, we need a chazkenu. We need an organization where I just thought it was going to be a phone meeting. It turned into an organization, but I felt that we needed a place where women who are experiencing any mental illness, have any sort of diagnosis, to have a place where they can really get the strength, but the strength even more from someone who's experienced it, someone who went through it. And also, I find that in my journey, the more I'm able to help other people and strengthen other people through my experience, I feel like I gain the strength, and that really empowers the women. So we have all different, you can look us up, chazkenu.org. We have all different projects and programs for women 18 and up with any mental health diagnosis. And we have such a combination of people and different diagnoses and ages and stages. And when we come for like a Shabbaton or a retreat, and we see so many different people coming together to connect based on our own experiences, there's such a relief. Like, I don't have to do this alone. I remember people coming up to me and saying, Zahava, the 2 biggest words I needed to hear was "me too." When someone tells you you're not alone, you're not the only one, it just feels so amazing. One of the places where I got the most response was on the Hackensack hotline. And it was the first time somebody heard someone share their story so publicly with including their contact information. And so a lot of people joined Haskenu through hearing my story. And it just brings so much meaning to the pain. And when I had my fourth son, at that point, I was seeing a reproductive psychiatrist. I had a room saved for me in the hospital. I was on, I went full force into higher doses of medications right after birth. And that was the first time after birth that I did not have a postpartum response. And I think of it as a real miracle. Unfortunately, when lockdown happened, and that was my last relapse, but I still thank Hashem every time that I'm able to go through hard, stressful times. And now with all the therapies and the modalities that I've used, I feel like this is what I always say. I always say that recovery doesn't mean you're never going to get sick or never going to get in a hard spot again. Recovery is when you have the tools to deal with whatever comes your way. And I feel like today, between my Haskenu sisters, my Haskenu family, my medication, my family, my therapy, my coping skills, I feel like today I can feel empowered to speak to all of you today and to let you know that we are so much more than our illness, and that of course it has to be taken care of, and nobody should ever hesitate to get the help that they need. And at the same time, you can live a productive life. If you meet someone who has psychosis, you could know and be assured that they will be an amazing teacher, an amazing friend, an amazing, you know, community member, and that no one should ever feel judged based on their illness, but rather, like I say, we're not amazing despite, but we're amazing because of what we've been through. Thank you so much.
Thank you so much, Zahava, for sharing with us. I want to remind everyone that you can send in questions into the Q&A box, and it will either be answered in writing during the webinar or at the end by the panelists. I'd like to now introduce Dr. Weinberger. Tal Weinberger, MD, assumed the role of Director of Psychiatry and Behavioral Health at CHEMED Health Center in Lakewood about a year ago. Previously, she was Clinical Associate Professor and Outpatient Medical Director for the Psychiatry Department at the Sidney Kimmel Medical College at Thomas Jefferson University in Philadelphia, and also maintained a secondary faculty appointment in the OBGYN department. She is founding director of the Jefferson Women's Mental Health Clinic and has also recently started a women's mental health clinic at CHEMED in partnership with Hackensack, Jersey Shore Department of Psychiatry. Dr. Weinberger completed her undergraduate studies cum laude at Yale University and attended medical school at the University of Pennsylvania School of Medicine. She completed her psychiatry residency at the Hospital of the University of Pennsylvania and a fellowship in cognitive behavioral therapy at the University of Pennsylvania. She is a consultant for the Perinatal Psychiatry Consultation Line for Postpartum Support International, consulting with providers on clinical questions in perinatal psychopharmacology. She lectures and has several publications in the field of women's mental health. Dr. Weinberger.
Thank you so much, Eliza. So I see a comment in the chat. Zahava, you're amazing. I want to just second that. We really, really, really appreciate so very much you being here and sharing your story. It's just so valuable to all of us. So thank you again so much. Okay, I'm going to share my screen. Okay, so sorry, one second. Okay, so we're here to talk about postpartum psychosis, kind of against the backdrop of Zahava's story. And I think we have two goals. Our first goal is to make sure that we're understanding postpartum psychosis, and the symptoms of postpartum psychosis, and kind of how to understand them, how to respond. But I think an equally important topic is what's not postpartum psychosis. And the reason I say that is because I treat a lot of women during pregnancy and postpartum. That's what I do. And recently, I've had many patients, like literally many per day, who don't have postpartum psychosis and have not had postpartum psychosis and are not at risk for postpartum psychosis, but who are very fearful of having a condition that might cause them to lose control and do something harmful. And so these are women who may have had postpartum depression or postpartum anxiety, or anxiety or depression outside of the postpartum period. There's just so much, I think, confusing information out there about psychiatric illness, and women, I think, are particularly vulnerable in the postpartum period, and they fear for their very, very vulnerable babies in the postpartum period. And so I want to take some time talking about what postpartum psychosis is, but I also want to take some time to talk about what postpartum psychosis isn't, in the hopes that we can recognize it better, but we can also recognize when we're not at risk. Okay, so that's my intro. So in general, we consider postpartum psychosis to be a psychiatric emergency, generally requiring immediate inpatient care. So it sounds like, I'm glad Zahava highlighted that point. It sounds like the practice in Israel is maybe different than the practice here, and I was trained here. But certainly, in a situation where a woman can, because she's not able to think clearly, and she's not able to be herself, and she's not able to use the judgment that she would normally use, oftentimes hospitalization with really constant, or nearly constant monitoring is warranted. The situation that Zahava described, where she was in Israel, where family was monitoring her all the time, can be an option in some situations, but oftentimes it really is not, because number one, we can't necessarily expect your family member to keep an eye on you at all times. That's not a realistic expectation. And we also want in a serious situation like this, we want you to be monitored by professionals who who can respond, and in a situation where really the woman herself, because she's so sick, can be at risk, and possibly other people can be at risk as well. So, but postpartum psychosis is really an entirely different illness than postpartum depression. There are different risk factors. There are different symptoms. The course of illness is totally different. And I think the most important thing is postpartum depression is common, and postpartum psychosis is very, 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 very rare. So incidence of postpartum depression is about 17 to 18% in the population in general. So a lot of women will experience postpartum depression in some form. The incidence of postpartum psychosis is about 1 in 1,000 to 1 in 2,000. And women who do have bipolar disorder are at higher risk. But overall, thinking about postpartum depression versus postpartum psychosis, many women, may be at risk for postpartum depression. Very, very few are at risk for postpartum psychosis. Recent high-profile cases of infanticide in the media, I think, are often characterized in a very confusing, misleading way. And often, newspaper articles are written about postpartum depression, sort of in these contexts, which is really just not accurate. Women who have postpartum depression per se, just postpartum depression without psychosis, without mania, are not at risk for harming their babies. Women with postpartum anxiety are not at risk for harming their babies, although many believe that they are. Okay, so going back to postpartum psychosis, sometimes it presents very, very, very suddenly. Sometimes it builds up slowly. Early symptoms can include insomnia. So Zahava mentioned sleep. Sleep is a really, really big factor here. Women who are immediately postpartum are likely to be sleep deprived, right? That sort of goes with the territory. So it's kind of like this perfect storm where these women are in the postpartum period where they're already at higher risk, and now they're sleep deprived because they have a new baby, and sleep deprivation can absolutely act as a trigger, but also as a symptom. And so women with postpartum psychosis or mania may not really feel like they need to sleep as much as usual, or they may not feel like they may not need to sleep at all. They can go for nights and nights and nights with very, very little sleep and not feel tired and still have a lot of energy. Oftentimes these women will really have very, very little insight into symptoms. They will not understand that there is something wrong. I think also, as Zahava described very, very clearly, they may have delusions. And what we mean by delusions are beliefs that are not, they're not flexible. In other words, like a woman with psychosis, with postpartum psychosis, may believe, like Zahava described, for example, that they're Mashiach or somebody else is Mashiach. And that's not something you can talk them out of. It's not like you can like present them with evidence for why it doesn't make sense that they're Mashiach and they'll believe you. That it doesn't work. These are sort of fixed beliefs. Hallucinations are usually auditory hallucinations, usually voices that people hear, and they hear it like an external voice, like almost like you're hearing my voice, right? Like you're it's very clearly not your own thoughts. You know, you hear the voices in the same way as you're hearing my voice right now. Their speech may be disorganized or illogical. They may appear confused or disorganized, which can affect their ability to appropriately feed or care for the baby. They may not respond appropriately to the baby's cues, or they may have impaired judgment that it compromises their ability to care for the baby. The thing that we fear most is this phenomenon of altruistic delusions, of suicide or infanticide to save themselves, or the infant from a fate worse than death, right? So sometimes the delusions will involve beliefs about their own um, about their own worth in the world, I think, as Zahava described, and sometimes also can involve beliefs about the baby that, again, the woman is not in control of. And we need to absolutely make sure that we're protecting both her and we're protecting the baby. Okay, so some of what I described is really symptoms of psychosis in general. Sometimes with postpartum psychosis, we can see mania, which is, I think, what Zahava described very, very, very clearly, which is sort of like an elevated mood, like extra happy, extra energy. Sometimes may go along with grandiose delusions, like that I'm Mashiach, or that I have extra powers or talents that other people don't have. The full range of symptoms may not be obvious at the time of the evaluation. And what's actually pretty unique to postpartum psychosis is we call waxing and waning. So women sometimes can appear to be really fine and converse rationally and can give family members and clinicians the impression that they're really okay and they've gotten better. And then symptoms can shift and they can get worse again. So in a woman with postpartum psychosis who is not necessarily receiving treatment, or treatment isn't necessarily as helpful as we'd like it to be, the fact that symptoms kind of get better briefly should not be a reason to think that, like, now we're safe and now the symptoms are resolved. Okay, so some examples of psychotic beliefs in postpartum psychosis, specifically related to the baby. So some women will have thoughts that someone is trying to harm them or to harm their baby. They may be suspicious of others, and they may not openly express their fears because they're the people that they would potentially express their fears to are people that they're suspicious of and don't trust. And so you might not even know that they're having these thoughts because they might not disclose them because of their fear around the people that they'd be disclosing them to. They may not allow others to care for the baby, and they may not accept food or medicine from others due to the belief that someone is trying to control or poison them. So that can be something that can get in the way of treatment. They may believe that their baby is evil or that their baby is not their baby at all. They may believe that their baby is seriously or terminally ill. They may have grandiose delusions or religious and grandiose delusions that such as a belief that they're acting in response to God's wishes and that they God is telling them to do something to harm the baby, or God is telling them to do something to harm themselves. The belief that an event or an object is a sign or a message specifically from them, which can influence their behavior. Like, for example, like misinterpretation of casual events as having personal significance, or thoughts that the media, news reports, or songs have a direct message for them. They may see a billboard on the highway and believe that something that's written on the billboard is specifically targeted towards them, for example. Okay, so what are some risk factors? So really the most significant risk factor is a history of bipolar disorder. So women with bipolar disorder are at quite high risk for having a postpartum episode. Many women with bipolar disorder will have at least one episode in the perinatal or the postpartum period. Then there are women who experience postpartum psychosis who may not have bipolar disorder, but they are, because they have experienced postpartum psychosis in one pregnancy, they are at very, very high risk for experiencing other episodes of postpartum psychosis in subsequent pregnancies if they're not treated. Women with bipolar disorder, I would be particularly concerned and watch them very particularly carefully in the postpartum period. And women who have had past episodes of postpartum psychosis, even if they do not have bipolar disorder, are at very, very high risk in subsequent pregnancies and postpartum periods. And having a close family member with a history of postpartum psychosis also does increase risk. But most cases that present in women without any prior psychiatric history, so about 50% of women who have postpartum psychosis, it's actually their very, very first manifestation of any mental illness. They've not had any signs of anything beforehand, which is, I think, what you described, Zahava, also. Really, and it's a multi-layered hit, unfortunately, because now you're a new mom, you're sleep deprived, you're experiencing all the emotions that come with this like major shift in your life, and then sort of suddenly you're kind of hit with this like really like very, very horrible illness. And so this can be very obviously very, very shocking for people and disturbing for people. So we talked about stress, and stress is complicated. Certainly in women with bipolar disorder, or really, many psychiatric conditions, stress can absolutely trigger symptoms, right? So I think that was what Zahava was describing. When you are under stress for whatever reason, because you're working through a trauma, because you had a loss, because you are very, very overwhelmed with a million things that you have to do, that certainly can be a trigger for an episode of mania, depression, anxiety. But interestingly, actually, in terms of postpartum psychosis, right, women who are at risk for postpartum psychosis are really at the same risk whether they're undergoing stress at that moment or not. So, which sort of underlines this as really a very, very powerful biological phenomenon, right? So women who are at risk are at risk. Certainly stress can play a role in worsening of symptoms of depression, symptoms of anxiety, symptoms of mania throughout the life cycle. But I will often have women who will come to me and they will have had an episode of postpartum psychosis, and they will say, well, doesn't it make sense that I had this happen to me? Because really, I had so much going on at the time and I was struggling with all these various different things. And doesn't it make sense? And the answer is really, yes, but no, right? So yes, it makes sense that certainly played a role in making, making things even much more difficult and unstable for you. But stress by itself doesn't cause postpartum psychosis. So in other words, for somebody to have an episode of postpartum psychosis, really what we see is there does have to be some kind of underlying biological vulnerability, either bipolar disorder or a biological vulnerability to postpartum psychosis. And so stress by itself isn't really an adequate explanation for an episode like that. Stress plus something else certainly is. Okay, so sleep is a really, really major factor. Women, like I said, women are already more vulnerable women with bipolar disorder are already more vulnerable in the postpartum period. And then, you take this already vulnerable woman and you sleep deprive them, and it's really, kind of a perfect storm. Sleep deprivation is absolutely a trigger for mood episodes and bipolar disorder, both in the postpartum period and outside the postpartum period. Regular sleep is essential. I will emphasize this with all of my women who I believe might be at risk for any kind of postpartum episode, but particularly postpartum psychosis, and particularly women with bipolar disorder. We really need to work out a plan in advance for them to have support around nighttime feedings. We can't, it's obviously not always possible to mandate that a woman is going to be able to get 8 hours of sleep every single night after their baby is born. But certainly kind of working out a plan for some sort of support where there's somebody else who's waking up with the baby in the middle of the night and allowing the woman to have stretches of regular sleep, ideally a full night's sleep, but certainly like long stretches of regular sleep is really, really essential in protecting this woman's stability and helping prevent an episode. I will also routinely talk to these women's OB providers before they deliver and tell them, look, like, we all know, right? Like, when you're in the hospital, they wake you up in the middle of the night to check your blood pressure and to check your temperature, every 4 hours or every 6 hours or however often. And what I will tell these OBs is let's, unless if we really have to, let's try to avoid that, right? Like, if you need to check this woman's blood pressure in the middle of the night because you're genuinely concerned about her, then please do. But if we can avoid routine wakenings in the middle of the night for sort of non-essential medical vital sign checks or other things, then that's really the best way to try to it's one of the best ways to try to protect this woman's stability. So our most feared outcome, infanticide. So this is a very real thing. The incidence of infanticide in women with postpartum psychosis with depressive features, so women who are psychotic and also depressed, is estimated to be as high as about 4%. So that's a really big number. It's a really scary number, and it really speaks to the importance of, preventative treatment. It's less common during postpartum psychosis without depression. And so, clearly not every woman is at risk for that, but because again, this is not a situation that the woman is in control of, she's not able to use her judgment, she's not able to act in accordance with her values, that it is very, very, very important for women in this situation to be monitored very, very closely, ideally in the hospital. Examples of some psychotic rationales for infanticide that we've heard from some women who have been through this. So belief that the baby is really gravely ill and the mother doesn't want the baby to suffer, belief that the baby is evil, could all be things that the mom believes, again, and these beliefs are totally out of her control and completely not consistent with who she is and her values. She may hear voices or have beliefs about messages from God or others instructing the mom to kill her baby. She may believe that somebody wants to harm the baby, and that her harming the baby herself is the only way to protect them from a much worse fate, or the belief that the mom is inherently damaging or toxic to the baby and the baby's death is preferable to life with the mom. So these are all things that we've heard from moms who unfortunately have thought about harming their baby, been close to harming their baby, may even have harmed their baby. And again, these are not beliefs that that the mom is accountable for in any way. That these are symptoms of her illness in the same way as nausea and vomiting is a symptom of an illness. And we have to make sure to protect mom and baby in this situation. Suicide is another outcome that we fear tremendously. Suicidal thoughts and rates of completed suicide are generally cited as being high in postpartum psychosis. And again, because the psychosis distorts perceptions and interferes with the ability to make rational decisions. Women with postpartum psychosis are at higher risk for suicide. And even when a woman denies intent to act on her suicidal thoughts, a woman who's psychotic, really, she should be evaluated emergently to make sure that she's not at risk. Preventative treatment is indicated in high-risk populations, and this is a whole other talk. I could spend an hour talking about this. Women with bipolar disorder often are going to continue their treatment that they were on before pregnancy, and it can be continued during pregnancy and postpartum. This can be done safely. There are many medications that we can continue safely during pregnancy and postpartum. Again, this is way too big of a topic for us to discuss, but it is something that people worry about really very much. But it is absolutely safe. Treatment can be achieved. And in general, treatment is safer and preferable for both mom and baby to illness. Okay, so I'm going to move on from that. Okay, so quickly we're going to talk about postpartum OCD and differentiating it from psychosis. So, okay, so perinatal OCD, prevalence of about 2% pregnancy and postpartum. When we use the term OCD or obsessive compulsive disorder. So what obsessions are intrusive, repetitive, unwanted, uncontrollable thoughts or images, often relating to the safety of the baby and concerns about doing something to harm the baby. So a lot of women who are struggling with these symptoms may describe, being in the kitchen with the baby and seeing a knife on the counter and suddenly having the thought that they could stab the baby with a knife, or they might be standing on the top of the stairs holding the baby and might suddenly have the thought that they could throw the baby down the stairs. This is the last thing that they want to do. They are horrified and terrified by these thoughts, and really are not at risk for acting on them in this particular setting. But they're horrified. They're horrified that they could act on them. Often they will not disclose these thoughts to others due to fear that other people might believe that they could act on them and that they may even lose custody due to safety concerns. Compulsions are what we call safety behaviors. So in other words, things that people with obsessions do to kind of relieve distress related to the obsessional thoughts. So some common compulsions that we see are people who repeatedly check the baby. I'll hear often the mom will go back in over and over again at night to make sure that the baby's still breathing. They may go to their pediatrician or call their pediatrician multiple times to ask about symptoms that they've been reassured about, just to make sure that they're not dangerous. They may do a lot of internet research in order to get reassurance. And they may go out of their way to avoid things that could be perceived as a possible risk for the baby. So for example, I've heard women who will say they won't have any knives out. They won't use knives because they're so afraid that they could use the knife to harm the baby that they avoid knives altogether, for example. So how do we differentiate perinatal OCD from postpartum psychosis? And this is where I think a lot of the fear comes in, because there certainly are similarities. But fundamentally, women with anxiety or OCD, when they have these obsessional thoughts, the thoughts are recognized as being in opposition to their values and desires. So in other words, the woman who's imagining stabbing the baby with a knife that's on her counter, again, that's the last thing she wants to do. She's terrified. She wants her baby to be safe. She does not want to harm her baby. But the thought just keeps on coming back. The thoughts are really recognized as being intrusive and distressing and causing anxiety, right? And oftentimes people will actually describe these thoughts as voices, right? Because they almost feel like voices, right? They're not their own thoughts. They're like, where did that thought come from? I did not want to be having that thought. But they're different from actual voices or auditory hallucinations related to psychosis in that the voices are external voices, whereas obsessional thoughts or intrusive thoughts are generally, when you ask, are recognized as being the patient's own thoughts, although they're very undesirable. Women with anxiety or OCD may have extreme compulsive or avoidant behaviors to prevent harm, like I mentioned before, may never use a knife, may never go near the stairs or the window because of their fear of you know possibly harming the baby related to these thoughts, as opposed to postpartum psychosis where the thoughts are not perceived as being misaligned with their values or desires. So Zahava described like feeling a connection with Rachel, feeling like somebody was Mashiach, right? That she really believed that. Like she wasn't able to question that on any level in that moment. Afterwards, she was. But in that moment, she really had no ability to kind of evaluate that thought. The thoughts are not necessarily perceived as distressing, and their presence doesn't necessarily cause anxiety. And women with postpartum psychosis will have other psychotic symptoms, generally, such as hallucinations, disorganized speech, or disorganized behavior. So, okay, I talked really, really fast. I'm going to stop sharing and let's take some questions.
Thank you so much, Dr. Weinberger. The first question we have is for Zahava, and it is, did you have any bipolar symptoms before the postpartum psychosis?
Okay, so thank you so much for the question. And for me in particular, I actually had never experienced any signs of it before. But when I had first become pregnant, like I said, I became pregnant right after I got married. And in the beginning of the marriage, I was making breakfast, lunch, and dinner. I was carrying on 3 different jobs. I was like very motivated and very, you know, just in a very stable place. And as the pregnancy was going on, I didn't know to compare it to, I just thought this was pregnancy, but I did notice a lot of lack of motivation, sleeping a lot, like waking up sometimes canceling things, avoiding certain situations. So looking back, I do think it was a mild depression. And I did see that as a cycle going forward, that the psychosis or mania would come after a most of the time mild depression. So that was the cycle that came about. And I just wanted to add, thank you, Dr. Weinberger, for all the it's really, having the knowledge is so important. And I also want to say that for me, I feel like I was very lucky that I was able to get help as quick as I could. Because I always say, like, if I would have stayed in that state, I wouldn't have had the judgment. And I also really resonated with the thoughts and not being able to explain the thoughts to me, because like when I was convinced that the nurse who was doing ECT was really, somebody who had already died coming back to, a teacher of mine who passed away coming and treating me. Like if somebody would have said, Zahava, that is not so and so, this is your nurse Dave, like I would have been like, what are you talking? Like I literally, like, my husband had sometimes tried to convince me otherwise of things, and he had to just give up, you know? And it came to the point where when I was asking different people if they were Mashiach, like the only way to get me to stop doing that was when I said to him, like, are you Mashiach? Because everybody else was telling me, like, no, I'm not Mashiach because of my Averos, and I was getting all frustrated. But when I asked my husband, are you? And he's like, I don't know. And that like actually quieted me down, because I was like, oh, he's the only one who didn't, say that. But that what I'm trying to say is that a lot of the things that I was thinking about, like, it are not things that would ever make sense to me as a stable person I am now, you know.
Thank you. A question for Dr. Weinberger. In terms of infanticide and or attempted infanticide, how do medical providers work with CPS and the legal system to make sure that women who are going through this are not held accountable for their actions?
So I mean, it's really tough, and the legal system is not perfect. Um, we, um, uh, I'm sorry, this is talking about a case of attempted infanticide or infanticide.
Yeah.
Yeah. So, not guilty by reason of insanity defense is certainly, it has been applied in these cases before. There are some very, very high profile cases in the past where women were convicted and then the conviction was overturned due to kind of experts coming in and weighing in. Reproductive psychiatrists absolutely can serve as expert witnesses in these cases, can testify on their behalf. Um, and again, this is an illness. Um, this is an illness, and women should not be held accountable for their actions.
Thank you. We have another question for Zahava. Can you speak to the spouse's role in this journey?
Yeah, I mean, definitely, like in my situation, my husband had no, experience with this at all, and it was a very big shock to his system. So I'll just say, like, as far as the spousal role, like when Dr. Weinberger was talking about, like, how it's so important to like sleep through the night and be able to have someone take care of the baby at night. So in my case, thank God my husband was able to wake up with all my children and feed them. But I definitely, if a spouse is not able to do that, which is very understandable, if they have to get up and do their own responsibilities, then, a night nurse is extremely important. I think as far as I'm going to speak now to a spouse, and I think that as far as the spouse goes, is that they have to make sure that they have their own support system. When I was in an episode, I was completely not able to be emotionally there for him, for my husband at all. And he needed to find his own people to speak to and be able to, he couldn't tell me how he was feeling about the situation. I would have probably gotten very, defensive about it, or, I just wasn't able to be there present for him. So he needed to get that. And also, a spouse is really the one who can see from the beginning before there are really any other signs. If they're seeing that, their wife is not sleeping, not eating, not taking care of themselves like they normally do, is doing things that they saying things that don't seem, accurate or representing who they really are. They're the first ones to to call the doctor and speak, every single time that, we had this, my husband always had, the doctor's number, his rabbi's number, like whatever, whoever we needed to be in touch with, the therapist. It was like we all worked as a team, and he was like really my advocate. Um, I think it was also really helpful to me that I never felt like my husband was judging me based on it. I felt like he was like, this is our package, this is our test, and we're going to get better. Like it's going to get better. And I think that that's needs to be the most important thing. Nobody asks for an illness. And it doesn't define us. Like Dr. Weinberger said, it's just like someone's experiencing these symptoms, just like anything else. And I do want to just add in that a lot of people say, like, my goal is to get off of medication, or I don't want to have to be on medication. And I just, just to tell you that there's nothing wrong with taking medication. It's a sign of strength, and it gives you back your control that you need to be who you really truly want to be. So the goal is never to avoid the medication. The goal is to try to find the right, mix of the medication so that you can be your best self. Thank you.
Before the next question, I just want to remind everyone, if you have a question, to put it in the Q&A box and not in a chat directly to the host. Dr. Weinberger, you mentioned that symptoms may seem to abate, but they may flare up later. At what point is it safe to leave a woman with her child or children?
So that's a great question. And I think it really, depends on a lot of different things. But if a woman is in treatment and the treatment seems to be working and they seem to be consistently better, right? It's not just like they're better for a couple hours or a day or so, but they're consistently better in getting back to themselves. And we see them sort of, not even necessarily being 100% better, but heading in the direction of being better and being able to be rational and think through things in the way that they normally would and use good judgment. So then that might be a point where we could consider that.
Zahava, we have one more question for you. How did you feel approaching each time you were trying to conceive and once you found out that you were pregnant, given your experiences with postpartum psychosis?
Okay, so for me, always envisioned a big family. I was very much into wanting to have, as many kids as I can. And it was very obvious for me. My first three kids are all 5 years apart. The last two are 3 years apart. And it wasn't because of, it was just finding the right time. And for me, I was always the one who said, I want to try again. I want to be able to have more children. And I definitely had to speak directly to my team. My psychiatrist was very, very hands on and involved. And that's why reproductive psychiatry, like Dr. Weinberger is doing, is so important. They are all the psychiatrists that deal with reproductive psychiatry are in the know of all the medications that are going to be safe for birth, are going to also be able to assess if you're in a good spot for it. So for me, I had that along with speaking to my Rav, who always, the first thing my Rav would always ask is, what does the doctor say? I've had doctors who say to me, like, I would never stop somebody from having a child. Let's just find the right time and the right, way. So for me, I always try to do things preventative during the pregnancy. The last time I went to my therapist twice a week. I was very seeing my psychiatrist every 3 weeks. I was like very, very much in communication with them, so I felt a lot more confident, but I have to be honest, of course, every single time I was nervous. And even till today, like I never know, what's going to be. And I think that what I just put in front of me is, am I doing everything I can to make sure that I will be successful, that I can be stable, that I can be healthy? And do I have a plan if something would come up? So those are the things I have in mind. And I'm very, very thankful that I do have my four children, and I am very open and talk to them a lot about it. And my oldest, like I said, it's been 19 years, and my oldest is 19. And even though he's a boy, he has some time before he gets married. But I think it's important for children to understand that things aren't always going to go so smoothly, and that there's a help out there, and there's nothing wrong with going and seeking help. It's a sign of strength, like I said.
The next question is, what initiatives are being introduced in Lakewood and the Jewish community at large in light of recent infanticide to prevent it from ever happening again?
Great question. I want everybody to keep in mind that infanticide is an incredibly rare event. It's incredibly, incredibly, incredibly rare. It's our most feared outcome, but it is incredibly rare. Really, the best thing that we can do is to, I think, like educate, and make sure that women who are at risk for psychosis or for postpartum psychosis are getting adequate treatment, right? Like the prevention is the best, is really the best cure, right? And again, remember, right, infanticide happens in the context of postpartum psychosis only when the woman is really, really completely disconnected from reality and from her values. So if we can prevent the illness from progressing to that point, that's really our goal, right? Is to prevent the illness from progressing to the point where the woman has postpartum psychosis, or if she develops postpartum psychosis, that we hospitalize her and protect her as quickly as possible. Um, again, I would sort of see this as like a very, very, very rare complication of a very serious illness. And so we want to do our very best to manage the illness and make sure that people are empowered to help women who are at risk manage the illness.
The next question is, there ever a situation where a woman isn't fully aware of what she's experienced and won't be vigilant in the future? How can family make sure a woman is fully aware of her situation?
Yeah, I'm not sure I totally understand the question. Is that if a woman, in other words, is the question like if a woman doesn't recognize if she's
Continued
developing
for
symptoms?
insight.
Yeah. So I think what Zahava said is actually huge. Like having the husband or other close family members like involved in the woman's care, and having them have a direct line to her care team is super, super, super important. I feel so much more less anxiety about my women who I know I can really trust their husbands. They really know what they're looking for. They'll notice subtle symptoms, and I will tell them, like, if things start heading in the wrong direction in any way, like, we don't want to wait until it gets really, really bad, right? If we're starting to notice that things are a little bit off, I want to know about that as soon as possible so that we can try to kind of get ahead of it and prevent anything from happening. Um, and also having regular visits. I think what Zahava talked about, if somebody's able to have really, really frequent therapy, that's great, right? That's sort of another set of eyes. um, I will often follow up with my patients who I think are at risk, very frequently after delivery, and just kind of making sure that her support system is empowered to reach out if anything changes.
Yeah, I just wanted to pop in also, because I get calls a lot from family members who say like, my child, my husband, my whatever it is not well, and they're not willing to get help, and they don't think they have a problem. They're not aware. They think they're fine, because they, let's say, have been depressed for a really long time, and then they get high, and they're like, they like it, they like the feeling because it does, it's like this. It's a feeling of like, whoa, like being on top of the world almost. It's not real, but that's what it feels like sometimes. And I feel like that's what I was in the beginning, where my friend was telling me like, Zahava, you need to get help. And I was like, what do you mean? I don't need to get help. You need to get help. So I have to say that no two people are the same. And I think the biggest thing is if we are in a position where we're trying to help somebody who's unwell and they're not aware of how unwell they are, the biggest thing is to show them like unconditional acceptance, unconditional love. I don't think any differently of you. I want what's best for you. I'll come with you. I'll help you. Like I feel like as far as Chaskinu goes, like the fact that people feel less alone will also make them feel like I could get help. Like just like she got help and she got better, I also can get better. So when the person is in this state where they actually absolutely have no idea how sick they are, sometimes they have to be taken against their will to a hospital or whatever it is. But we're talking about in a case where you can convince them. I think the biggest thing is to show them that you are there with them, you're holding their hand, and you don't think any differently of them, and that maybe putting them into touch with other people who have been through it and have gotten better. And sometimes, if you can, like if they're at a state again that they're willing to listen, is you could say, normally you wouldn't be doing A, B, and C. Like, I'm noticing that you're doing this. Like, is it possible that you can call your doctor and let her know what is happening, what we're noticing? So again, it really has to depend on how willing the person is to listen and to take, put the whatever effort they need to get better. Or if they're just completely unaware, then sometimes they have to be taken care of, from the outside place.
Thank you. The next question is, how fast do symptoms occur? Do they come up very suddenly? If someone is at greater risk for postpartum psychosis but is fully stable during the pregnancy without medication, would preventative measures be to medicate before, or is it safe to observe closely and see how things develop?
That's a really, really great question. Symptoms can actually develop very quickly. Most commonly, symptoms develop between like day 1 to 3 postpartum, although they certainly can develop later as well. But the most common situation is symptoms developing very, very, very quickly. Um, in a woman who is at risk because she's either had a prior episode of postpartum psychosis or because she has bipolar disorder, if she's not on medication during pregnancy, I really would recommend preventative treatment. Um, in general, ideally we would start a medication towards the end of pregnancy, just because we want to make sure that the medication is really fully in the woman's system before she delivers. But certainly, at least immediately postpartum, medication can be started. at a woman for a woman who's at risk, because she has bipolar disorder or because she's had past episodes of postpartum psychosis, I would not recommend watchful waiting. I would recommend treatment again, either immediately before delivery or immediately after delivery, because the risk is so high and the downside of missing this is so significant.
Branching off of that question, is there any evidence that once there is a postpartum psychosis episode, one should be treated for bipolar or a mood disorder for the long term?
That is such a great question also. And actually, I would have answered that question differently 20 years ago than I am now. When I was in training, we were taught that yes, if somebody has an episode of postpartum psychosis, that means that by definition, they have bipolar disorder. This is their first episode. They're going to go on to develop bipolar disorder. There was actually a very, very well done study that was done just a couple of years ago, testing that theory, and they followed out thousands of women for 16 years, women who had one episode of postpartum psychosis and nothing else. And what they saw in those women is that a little bit over 50% of those women did go on to develop symptoms that were consistent with bipolar disorder. So more than half postpartum psychosis, in fact, was the first episode of bipolar disorder. And the other 40 some odd percent, they did not. They went on to develop either no further episodes or only episodes in the postpartum period, but nothing beyond episodes in the postpartum period that was consistent with bipolar disorder. So what we take from this is that postpartum psychosis really is um, um, it should kind of raise a red flag, should make you very, very watchful about that this is somebody who might develop postpartum bipolar disorder. And over 50% of women who have an episode of postpartum psychosis will go on to develop bipolar disorder. However, the other 40 something will not. So then at what point does it become safe to say we're going to stop treatment? So I think there are lots of factors that would go into that decision. Certainly anybody who's had postpartum psychosis definitely needs treatment, at least in the postpartum period with any subsequent pregnancies. But whether they need long-term treatment forever, it can be, if this is a woman who's had really no other episodes, no even like subtle episodes of mania. And sometimes if you ask really, really carefully, you can discover that they actually have had some symptoms that really, may not have caught their attention because they were so subtle, but that would make me think that this was somebody with bipolar disorder, or somebody who's had episodes of depression might make me think this is somebody who's at higher risk for actually having bipolar disorder when they've had an episode of postpartum psychosis. And so it's definitely, it's a conversation. It's an individual judgment. If this is really the only sign of bipolar disorder this woman has ever had was this one episode of postpartum psychosis, it can be a reasonable decision to try to stop medication carefully and watch very, very carefully, as long as that woman is not immediately postpartum.
For our last question, it is, what is the likelihood that children will develop bipolar disorder?
The children of women with bipolar disorder will go on to develop bipolar disorder? That's a great question. I don't know the exact number, but bipolar disorder is an illness that runs in families. And so if you have a first degree family member with bipolar disorder, a first degree family member of somebody with bipolar disorder is certainly at higher risk of developing bipolar disorder than somebody who doesn't have that relative. And kind of the further out you go, in other words, if it's an aunt with bipolar disorder or a grandmother with bipolar disorder, the risks become the increased risk becomes less as kind of the more distant the relative is. But certainly a sibling with bipolar disorder, a parent with bipolar disorder, that person is absolutely not guaranteed to have bipolar disorder. And certainly many children of parents with bipolar disorder will not go on to develop bipolar disorder, but they are at increased risk.
Thank you so much. That was our last question for tonight, but I want to share a comment from the audience. The person wrote in, I had postpartum psychosis after one of my kids, and I went through the legal system, and I wanted to share words of encouragement that CPS worked with me to have a really, really special caseworker who worked side by side for me. When CPS wanted to take me to court before allowing my kids to return, the judge overruled CPS and said, psychiatric illness does not define a bad mother. Actually, her going for treatment shows what a good mother she is. So I just wanted to close with that, say thank you again to Zahava for sharing your story and Dr. Weinberger for sharing this education. We really appreciate you both joining, and thank you to the audience for your participation.
Thank you so much.
Thank you.